everyone. Welcome to today's webinar on such an important topic, generative AI in healthcare. We're so pleased so many of you have joined us from all around the world. I'm Joni Watson. I'm the Vice President of Marketing and Communications for the Broadreach Group. It's my great pleasure to have all of you here. These sessions, we mean them to be really interactive. We'd really love to get our community asking questions, making comments. So please do so throughout. If you've joined us on Zoom, you'll see the Q&A button. Please feel free to ask questions and we'll answer them either through typing or in the Q&A section in a little bit. If you are joining us on our YouTube live channel, please pop your questions in the chat and we will pull them through to our panelists. Now, without further ado, I would love to introduce you to the moderator of our session today, Dr. John Sargent. He is the, hi John. John is the co-founder of the Broadreach Group, as well as Vantage Health Technologies. He's a leader, thought leader in health equity and really technology and innovation. I think it's going to be a great chat. So I'll leave the rest in your capable hands, John.
Thanks, Joni. Thank you so much. And I just want to thank our audience, say good afternoon to those of you joining from Africa and Europe, and good morning to those of you joining from the United States. We've got a really, really interesting panel, and we've got an amazing audience that represents all aspects of global health, from donors to governments to implementing partners to digital health organizations. So I think this is going to be a very lively discussion. I expect lots of great questions. And also think about this as an opportunity to collaborate, because we're just starting on this journey of generative AI. And I would love to see collaborations coming out of this, this webcast as we start learning and meeting different folks and interacting via the Q&A. So having said that, I think this is a really timely topic. I think every day when you open up the news, you hear something about generative AI, something about ChatGPT, and you hear things such as it's going to spell the end of the world or it's going to be the savior of the world. And I think the reality is, like anything, it's probably going to be somewhere in the middle. And ultimately, it's how we as human beings end up utilizing this technology. So this is a really important topic, a really important discussion, and we have an awesome panel that I think will bring different viewpoints to this discussion. So without further ado, I'd love to introduce the panel. The first person is Vedanta Singh, who was a research manager and PhD candidate at the Graduate School of Business at the University of Cape Town. Vedanta is a multidisciplinary scientist and researcher working in healthcare, technology, and organizational management. In 2020, she published the first policy guidelines for the ethical use of AI in healthcare as part of the Policy Action Network for South Africa. She focuses on ethical organizational decision-making using AI and investigates the equitable use of this technology to enhance Africa's response to the growing healthcare burden. Welcome, Vedanta, and we look forward to your viewpoints and your experience. Our second guest is Ruan Viljoen, the Chief Technology Officer of the Broadreach Group and Vantage Health Technologies. Ruan is an innovator in business technology solutions with over 20 years of experience in all aspects of software development and the whole entire support lifecycle. He served as CTO across the Broadreach Group for the past 7 years and has become passionate about how technology can play a role in enabling healthcare workers to save lives. As such, he has been integral in developing the roadmap for the Vantage platform and its safe and effective use of AI technologies. And last but not least is Jaya Plamanaban, the Chief Scientist of New Fire Global. Jaya is a seasoned healthcare technology executive and entrepreneur with deep data science, machine learning, and engineering management expertise. He has over 20 years of experience leading healthcare organizations through lifecycle phases, from startup initiation to scaling operations to cornering the market. Jaya is currently the chief scientist and co-founder of New Fire Global Partners, a global engineering consulting firm that specializes in supporting early and mid-stage VC and PE-backed digital health platforms. Prior, Jaya launched 2 digital health platforms, one which was acquired by IQVIA. Welcome, everyone, and we really look forward to chatting. Before we turn over to our esteemed panel, I just wanted to set the stage for today's discussion. And I actually want to go up to the 50,000 foot level and actually go beyond generative AI. and ask two questions. The first question is, why is this discussion even important? And I think there's two reasons why this is an important discussion. The first is, in healthcare, we face an issue, no matter whether you're in sub-Saharan Africa or in Western Europe or the United States or in Asia, we have a fundamental issue, which is demand outstrips supply, meaning that there are going to be, and there are a lot more patients who need health and services and medications and treatments and therapies than we can actually provide, because we don't have enough doctors, we don't have enough nurses, we don't have enough resources, we don't have enough medications. And so there's this mismatch and this misbalance. To give you an example, in sub-Saharan Africa, where we do most of our work, there is 0.2 doctors per 1,000 people. And the average spend in the government health system in sub-Saharan Africa is anywhere from $30 to $50 per person per year. So you can imagine in these settings, there's a vast sort of need for services and a very limited ability to supply those services. And to complicate this matter even more is that we're trying to build and deliver health in an antiquated system. The system we use today is based on sick care, and it's something that was developed in the 19th and 20th centuries. And it really focused on, when people get sick, they go to a particular facility, a hospital or clinic, to get care. And in that hospital or facility, there's a certain number of doctors and a ratio of those doctors to nurses, to other healthcare workers, to patients. The fundamental problem is we're trying to replicate that model in this world where we have increasing shortages of doctors and nurses. That's got to change. That's like trying to pedal your bicycle at first gear as fast as you can and being frustrated that you can't actually go more than 10 miles an hour. So what we fundamentally need to do is to change and transform this paradigm for how we deliver care. So how do we think about technology so that it keeps people healthier? How do we think about technology so it keeps people with chronic diseases like HIV or diabetes in a place where they can self-manage and not demand a lot of resources from the supply side? And on the supply side, how do we use technologies and innovations to change the model and to make us more effective and efficient? And this is the big question facing us over the next 20 plus years, because we are entering this phase called the fourth industrial revolution. And today it's generative AI, but it was blockchain last year. Next year, it's going to be something else. We're going to see more and more innovations rapidly coming in the next 10 to 15 years. So our ability to look at and understand what makes sense and how we can apply this to healthcare is what's going to determine whether we're going to change this model and try to rebalance the supply-demand equation. The second question, before then turning over our panels, is that, okay, well, if we're in this case where demand outstrips supply and we're in the fourth industrial revolution and we need to have these conversations and think about how technology can transform the model, what are some of the principles that we need to start thinking about to apply as new technologies come? Because we're going to have this conversation again next year. I promise you, it'll be on a different technology, and we'll have it the year after and the year after. And this is by no means an exhaustive list, but I would say principle number one is that technology is a means to an end and not an end in itself, right? So it's a tool. And our aim is to improve patient care, improve access of care to those who need it, and to improve quality of care to those who receive the care. And to do so by also helping healthcare providers, doctors, nurses, social workers, community healthcare workers. Once we start forgetting that and we get so excited about the shiny new toy, and this happens to me all the time because I love technology, we lose the relationship that technology should have to our aims. And that's really important. And the second thing is that as these new technologies come out, regulations, policies, ethical guidelines aren't going to keep up with this. So how do we ensure, like in the case of generative AI, that we are absolutely protecting patient privacy, that we're preventing things like bias in the models that we use that could ultimately harm certain subgroups in our population? And then finally, how do we scale this innovation? If it really works, and it is one of the things that's going to transform healthcare, how do we scale it in an equitable way? How do policymakers, donors in the global health space create an enabling environment so that the right technologies get out there safely, but not too slowly? How do we create a market set of mechanisms to encourage innovators to innovate and to change the model? So I think that's a really broad framing. And today we'll dive deep into generative AI, but I think it's very important to understand the bigger picture of the issues we face. And so first, I'd like to turn to you, Jaya, and maybe just to get some of your initial thoughts and reactions based on your experience, your multi-decades experience working with data and technology, and so your thoughts on this comments and just based on your experience working with clients around the world.
Sure. Thank you, John, and thank you for having me here. So for today's discussion, I would like to focus on the future of healthcare and the role that generative AI can play in it, and how to ensure generative AI, as you mentioned, John, is a means to an end to support better delivery of healthcare and not just another shiny object that we're experimenting with. So let's start off by understanding that generative AI is a type of artificial intelligence that can create new data such as images, text, music. It is still in its early stages, but it's already having a major impact on various industries, including healthcare. In healthcare itself, generative AI is currently being experimented to develop creative solutions to challenges such as, for example, creating personalized treatment plans. Currently, generative AI is being used to create personalized treatment plans by analyzing patients' medical history, symptoms, and other types of data to identify patterns and trends. This information can then be used to generate a treatment plan that is tailored to individuals' patient needs. For example, generative AI can be used to identify patients who are at risk for certain types of conditions, or to recommend treatment plans that have shown to be effective for patients with similar symptoms. This can be used to help improve the effectiveness of treatment and to reduce side effects. Another example of generative AI being used in healthcare is in the space of drug development and therapies. Generative AI can now be used to develop new drugs and therapies by analyzing vast amounts of data sets of chemicals and biological molecules to identify new compounds with potential therapeutic properties. This can be done by using generative AI models to generate new molecules that are either similar to known drugs, or by using AI to screen large amounts of data sets of existing molecules for those that may have the desired properties. Now, generative AI is also currently being used in terms of improving the accuracy of how disease is being diagnosed. This is done by analyzing vast amounts of medical images and text data. And this is also done by training generative AI on large data sets of such data, including patient data, so that the models can then be used to generate new images or text that are similar to the data that was trained on, to help doctors provide better and more accurate diagnosis of diseases than previously possible. Generative AI also is currently being used in the space of clinical trial recruitment. Generative AI is being used to create personalized recruitment messages, and chatbots are being used to target potential participants based on their individual characteristics and preference. And the idea is to be able to utilize these types of technologies to attract and motivate the right patients to participate in clinical trials. Finally, another area where generative AI is being applied in healthcare is in the crucial area of patient engagement. Generative AI currently is being used to create personalized patient experience by generating educational content and chatbots and other interactive tools that are tailored to each patient's individual needs, so that it can then be used to analyze the patient data to identify trends and patterns and improve the delivery of care. So these are just some examples of how generative AI is currently being applied in the healthcare space to solve existing challenges. But generative AI has the potential to revolutionize healthcare as a whole. It can help improve patient care, reduce costs, and make healthcare more accessible to everyone. However, it's not the silver bullet. There are definite risks associated with generative AI. For example, if generative AI is used to create fake medical images or data, it could lead to misdiagnosis and other types of problems. So it's important to be aware of these risks and to take steps to mitigate them. Overall, generative AI as a tool is extremely powerful and has the potential to make positive impact on healthcare. However, it's important to use it reasonably and be aware of the risks, as I mentioned above. What we need to do is look out and be careful in terms of how the data is being applied into generative AI. Some examples of how or what to look out for is data biases. Generative AI models are trained on data. And if the data is biased, the model will be biased. And this could lead to discrimination against certain groups of people. Data privacy. Generative AI can generate new data, but it's important to protect the privacy of the data that is being used to train the model. And finally, data security. Generative AI models can be used to create fake medical images and data, which can be used to commit fraud and other types of crimes. So it's important to secure these models and ensure that the models are only accessible to the right and authorized users. So with having said all of this, what does this mean from a healthcare worker's perspective? Well, with these advances and potential of generative AI, there's certain new types of functionality and features that we can offer to healthcare workers. Like, for example, more efficient workflows. Generative AI could help healthcare workers automate some of their tasks and free up their time so that they can focus on the more important aspects of healthcare, such as providing personalized patient care. Generative AI can help improve decision-making. Generative AI can help healthcare workers make better decisions by providing them more data and insights in real time. And finally, as I said earlier, personalized care. Generative AI can help healthcare workers provide more personalized care by tailoring treatment plans, education materials, and interactions directed to the individual's patient's needs and personalities. So overall, generative AI has the potential to make a positive impact on healthcare. It can improve patient care, reduce costs, make healthcare more accessible to everyone. However, it's important to use it reasonably and be aware of the potential risks that comes along with it. So thank you, John, for this opportunity to share my thoughts on how generative AI can help shape the future of healthcare.
Thanks, Jai. And I'd like to maybe just piggyback on your comments and go a little bit deeper. Given that you have the opportunity to work and see lots of different health technology companies across the world, and you did touch a little bit on data bias and privacy, but based on what you've seen, what are some of the things that you think that the healthcare industry needs to keep in mind when they decide how to engage with generative AI technologies?
Great question, John. Yes, when considering how to engage with generative AI in healthcare, there's several important factors to keep in mind. While generative AI presents exciting opportunities, it's also crucial to approach its implementation with caution and a focus on responsible and ethical practices. Here are some key considerations I generally tend to think about when approaching any new project that is looking at applying generative AI in its solution, especially when it comes to healthcare. One, data quality and bias, as I mentioned earlier. Generative AI relies heavily on data to be used for training. So therefore, it's essential to ensure that data is of the highest quality, it's representative and unbiased. Bias or incomplete data can lead to biased, inaccurate outcomes, potentially perpetuating healthcare disparities and unfair treatment. So rigorous data curation, cleansing, and validation should be in place to address these questions. Two, regulatory and ethical compliance. Healthcare organizations must adhere to strict regulations and ethical guidelines to protect patient privacy and confidentiality. So when using generative AI, it's vital to ensure compliance with applicable laws such as HIPAA or GDPR. Transparent and informed consent should be maintained, and appropriate measures should be taken to safeguard patient data. Three, explainability and transparency. Generative AI models can be complex and difficult to interpret. So it's really important to prioritize model explainability and transparency to build trust among healthcare professionals, patients, and their regulatory bodies. Efforts should be taken to develop techniques and tools that enable understanding of the decision-making process within generative AI so as to ensure their outputs are interpretable and accountable. Four, would be continuing validation and evaluation. Generative AI models need to be continuously validated and evaluated for their accuracy, reliability, and safety. Regular monitoring and auditing should be conducted to identify and address potential biases, errors, or limitations in the models. ongoing evaluation is essential to understand the real-world impact of generative AI technologies and to refine them based on feedback and new evidence. 5, human oversight and collaboration. Generative AI should augment human decision-making rather than replace it entirely. Healthcare professionals should maintain a central role in the decision-making process, leveraging generative AI as a tool to enhance their expertise and provide more informed care. Collaboration between AI experts, healthcare professionals, and policymakers is crucial to ensure the responsible and ethical use of generative AI. And finally, impact on trust and patient-provider relationship. Introducing generative AI technologies in healthcare can have implications on patient trust and patient-provider relationships. Open, transparent communication of the role of generative AI, its limitation, and the value it brings in healthcare is necessary to maintain trust and foster patient engagement. Patients should have the opportunity to provide informed consent and have a clear understanding of how generative AI is being utilized to support their healthcare journey. So, in summary, the healthcare industry should approach engagement with generative AI technologies carefully, considering factors such as data quality, regulatory, compliance, continued validation, human oversight, patient trust, and finally, a point that gets overlooked, explainability. By prioritizing responsible implementation and ethical considerations, generative AI has the potential to significantly benefit healthcare outcomes, while upholding patient privacy, fairness, transparency, and trust. Thank you, John.
Thank you so much. Next question is for Ruan. So Ruan, with your CTO hat on, what do you see as the greatest problems that generative AI can help solve within our healthcare environment?
Thanks so much, John. I appreciate the question. And I want to join the thought that you started in your introduction about the technology being there to serve a problem and not the other way around. And so I'm glad that you're asking about the problem first and not the technology specifically, because I think we need to be grounded in the business problem and then work our way back to the technology. There's a fairly well-regarded individual by the name of Marty Kagan in the world of technology product management. He uses a phrase that I love, which is we should be falling in love with the problem and not the solution. And I think for all of us in the meeting today, if we fall in love with the problems that healthcare or the lack thereof for many people bring, and not necessarily the specific technical solutions, then we're well on the way to solving this in a more systemic way. So in healthcare, we have many unsolved problems, and we've seen significant advances over the past few decades addressing many of these issues. In my mind, the biggest unsolved issue still remains health equity or health inequity, depending on which way you look at it. You mentioned the statistics, where in some communities, the ratio of a doctor to patient is just so low that the chances of providing good healthcare is very, very small. So the reality is we live in a world today where access to good healthcare is not equal, and depending on your race, your age, your sex, or your location, you can have a very different healthcare experience than your neighbor, even across the road or across the country. So what I'm most excited about is the potential of generative AI as a technology to help us close some of these health equity gaps that we've been working on, for many decades. So I like to get practical. I'm a technologist, so I always like to see if we can get to practical examples of how this can be used. And you again touched on this gap that we have between supply and demand. And I think that is true across all of the healthcare value chain, but specifically on the front line. We know our frontline healthcare workers are overburdened by just having to attend to too many patients. And there's simply not enough time in a day to deal with all of the needs that exist. And so one of the things we can do, again, keeping the problem mindset in mind, is to go and sit and work with these individuals and find out, what are the repetitive tasks that they are doing every day? What are the things that are stealing their time? And I think you'll find often these are administrative burdens, reporting burden that's placed on them, you know, from management and donor-funded requirements, that we could look to deploy this technology. And the goal there is not to replace a role, but to free up the role, you know, or the individual to do value-adding work, spend more time with patients, be able to see more patients in a day than is currently possible. And so one practical example that we're currently investigating and doing some pilots with is to do better automation of data capture. Mostly today, the patient interaction is captured in handwritten patient notes. Those have to be transcribed, often, you know, with challenges in accuracy into some medical or record system. And if we can automate that process, you know, and provide the clinician a first version of a populated health record for them to review before the final submission, that can, you know, relieve a lot of burden in terms of doing administrative work. So that's one example on the front line with the healthcare worker specifically. If we go up a level and we look at the healthcare system as a whole, we can deploy generative AI to help healthcare workers understand what is the next best action. What can they do on a day-to-day basis that will drive improvement and have impact? And this is often very difficult to see when you are dealing with the micro on the ground, but we can use the technology to look at these large data sets that Jaya referred to and extract the insights that healthcare workers need to make the right decisions. And what makes me most excited about this part of the journey is that we can leapfrog a lot of the complex data tables and graphs that we've been presenting to people, expecting them to act upon that, and provide the guidance in easy to digest emails. You know, just like a manager would type an email to a staff member, we could generate those using these text-based technologies, or we could send a WhatsApp message if that is the channel that the healthcare worker is mostly engaging. And I think what I want to highlight here is that this is not a groundbreaking idea. We've been in Vantage generating these emails and text messages for close to a decade. What excites me about the current advances is the level with which the accuracy and the quality of these messages have improved to the point where the impact that they are having is significantly more than what we currently have rolled out into the field. So these are just two examples. I can think of many more, but the point I want to highlight, and Jaya also touched about this, he mentioned the word augment, which is you know, something I really agree with. AI is not about replacing human effort. It is about bringing the human and artificial intelligence together to provide a better level of service that we couldn't do individually, neither the humans nor the AI individually. And I think that's what we should be searching for as we unpack these solutions. How do we bring human and artificial intelligence together to augment and not replace?
Great. Thank you, Rowan. And last but not least, Vedanta. So the first two panelists have talked a lot about the potential from the technology perspective and the application in the healthcare value chain. But before we get too carried away, can you talk about the ethical guardrails and potentially also the impact then on policy and regulation? Because ultimately, at the end of the day, we have to have the right guardrails and frameworks in place. Otherwise, I fear that we can get a lot of bad results.
Yes, thank you, John. That's an important question. But firstly, hello, and thank you for all of you for attending this webinar today. And my fellow speakers have done an exceptional job really at highlighting the immense opportunity that generative AI has specifically for healthcare. I'm also proud to say that they have gone beyond the hype and have stepped into reality, giving us a very balanced view. And the reality is that, like every other tool, generative AI comes with limitations and ethical risks, and especially when it's being applied to something as important as healthcare. Now, there's a perception out there that there are no regulations in place at the moment, but in reality, we are not starting from scratch. A number of regulatory authorities and even watchdog organizations have initiated policies and guidelines that govern the use of AI, and we can apply these to generative AI. So to assume that we are operating in the Wild West of innovation is actually far from the truth. So on the international scene, the UN and the OECD, or the Organization for Economic Cooperation and Development, have called for member states to reevaluate their existing strategies on AI to take into account generative AI. So across the globe, there's this mobilization to adapt and relook at existing strategies and policy around the use of this technology. For instance, the EU has put in an amendment to their act when it comes to generative AI and asking companies to publish summaries of copyrighted data that's being used for training and to design models to prevent the generation of illegal content and disclosing sources of information generated by the model. So we are seeing this slow but surely present move to mobilize new policies around this technology. So closer to home, experts in Africa in a recent African summit on technology have emphasized the importance of regulation. And that comes from all avenues, from companies, from governments, from individuals, in order to reap the full benefits of generative AI. So countries like Egypt, Rwanda, and Mauritius have already developed strong, robust national AI policies. And although none of them have to date specifically mentioned generative AI, I feel that this is in the pipeline. And we can learn a lot from what these nations have already put in place. For instance, Egypt has this clear emphasis on ensuring that human labor is not completely replaced by AI-driven innovation. And that is the entire premise of the human in the loop. And it comes into play when we talk about healthcare. And the Jaya has mentioned already that, and so has Rwanda, that the idea is to augment an existing healthcare system, not replace it. Rwanda, which has always been an excellent case study in how AI can be used in healthcare, has developed a policy around AI companies needing to ensure the tech is used to empower citizens. And to empower means to give citizens agency over their personal data and an informed knowledge of how that data is going to be used. And that's very important when we look at existing open AI systems such as ChatGPT. In addition, Rwanda has also asked companies as part of their policy to enable trusted and secure data flows, both domestically and internationally. However, although no such formal policy around AI and healthcare exist in South Africa, we are not starting from absolute scratch. There are some guidelines in place, such as those published in the Policy Action Network around the use of AI and data in healthcare. And there are also a number of key policies embedded within our constitution that we can draw from. And these guardrails are super robust and have been embedded into the National Digital Health Strategy, for instance, which seeks to use digital health technologies to augment and not replace existing systems. And this policy acknowledges the need to skill and upskill healthcare workers to empower them to use these digital technologies. In the case of generative AI, one of the key skills that we would hope healthcare workers develop would be the skill of critically evaluating information, as an example. Another important policy is the National Health Act, which stipulates the protection of patient confidentiality and health information, and that should be prioritized over all else. And this protection of personal information is further supported by the POPI Act, for instance. And we therefore, in South Africa, John, have this unique opportunity to develop our own policies to ensure that these ethical issues are taken into account from inception to deployment. And we call that having guardrails in place by design. And guardrails by design means that companies develop generative AI systems or generic AI systems that have ethics embedded into the system from inception to deployment. And that includes how information about the system is portrayed in the media, how limitations are communicated to the public in the media as well. And these companies need to ensure the necessary cybersecurity measures are in place to protect personal health data and privacy. And finally, I will say that in the absence of any specific policy and regulation, companies need to put in place their own mechanisms to deal with data breaches and accountability. And to do this, companies and institutions need to be fluid in how they respond to ethical risks and perform routine ethical impact assessments to constantly keep ahead of the changing technologies that come our way. And with that, John, I hope I have helped answer that question. Thank you.
I think we can spend years talking about this topic, but I'm excited. You're absolutely right. I mean, it's not as if technology hasn't happened before generative AI. We've had to deal with technology for decades, and I like your approach that we have a set of principles and frameworks in place. So how do we add and build on that? We're getting a ton of questions from our participants, but the one question I did want to follow up with you specifically, Vedanta, on based on your comments, is that, you know, at the end of the day, the ethics and then the regulatory frameworks that come from that and the policies at the government level are critical. But how do we strike the right balance so that it's not, on the one hand, so onerous that we don't create an enabling environment for, you know, government donors and private sector, particularly in global health, to actually sort of experiment and flourish? But how do we not be so far on the other side of the spectrum that it's a wild west and, you know, really bad things happen?
Good question, John. And I think if we stick to the core fundamental principles of why we have guardrails in place, and that first and foremost is to protect human rights and human privacy, privacy of information, protection of private information is part of that. And so I think there are core values and core ethical and legislative considerations which are immovable. And those need to be embedded into every technology that we work on. The experimental, it does leave room for quite a lot of experimentation though. And so I'm not too concerned that we are going to be too limiting to companies. I think innovation happens where there is need, and boy, do we have need, especially in healthcare. But I think if we just stay grounded to core principles that we are unmovable upon, I think there's that opportunity to strike a balance between the really fun things that we can do, the really innovative things we can do, but at the same time, not compromising on the human at the middle of it, the patient in the middle.
Well said. Thank you. Just looking at the webinar chat. So there's a question, maybe Jaya, this might be for you. So it goes, in my understanding, generative AI refers to models such as ChatGPT and Stable Diffusion, and not, for example, to machine learning models used to detect TB on digital X-rays. Is this how you understand it?
Had to unmute myself. Thank you, John. Yeah, interestingly, I was actually trying to respond to that question, but let me expound. Yeah. So first and foremost, it's important to understand what is ChatGPT and Stable Diffusion. So ChatGPT and Stable Diffusion are essentially applications built and trained from machine learning models such as the Transformer Neural Network and the GAN networks, Generative Adversarial Networks. So and so that's what so ChatGPT and Stable Diffusions are outputs of ML models. And in the case of developing solutions for detecting tuberculosis from digital X-rays, there are multiple different machine learning models we can use. One of the three most common machine learning models that we have used historically to be able to detect abnormalities from DICOM images or from radiology images fall in three categories. One is called the CNNs, or convolution neural networks. Another one is support vector machines, and lastly, random forests. However, it's important to understand that in terms of deciding which model to use, or should we use a combination of something known as an assembling of models, the choice of models and the choice of solutions is largely driven by a couple of factors, including things such as the size and quality of the data set, the availability of computational resources, and most importantly, the desired performance. So therefore, when it comes to choosing machine learning models to solve specific problems, it's key to understand what is the problem that we're trying to solve, who we are trying to solve with, and what is the desired outcome. Utilizing these three initial metrics, we can then decide what is the right machine learning model to start off with in order to achieve the desired outcome and solution.
Thank you. Another question, this is probably Ron, best for you. Considering that many problems exist in very remote areas where the residents hardly have access to the internet, if we're to be providing generative AI-based solutions, how can this technology be more inclusive of such places, since that's where most of the problems exist, especially in healthcare? So great question. I think that goes directly to your point around the disparities that you commented on.
Yeah, that's an excellent question. Thanks, John. So I think, firstly, I'll say that internet connectivity is getting better, and we see expensive technology like satellite internet is becoming more ubiquitous. It's now becoming a consumer product, and hopefully it'll one day be as widely available as mobile phones are these days to everyone. But if we park that for the moment and let's assume that is a decade or so off, I think there are a couple of things which gives me hope about providing equitable service in rural areas. The one is the focus of all of the big cloud providers to provide what they call edge computing. So this is essentially bringing compute closer to the edge of where actual work is happening. So think about it, taking a little bit of Azure in the case of Microsoft, or AWS in the case of Amazon, and deploying it in your house or in your clinic, and getting the same level of service locally. The second one is the mobile phone, which in the last decade and a half that it's gained popularity, we've just seen incredible increases in performance, availability, battery life, and it is becoming a very, very powerful computer that is in many pockets around the world. And while many of the models that we have today, like ChatGPT, is too complex to run on a mobile phone, there is a model which is good enough and can run on a mobile phone. And so I think, again, once we start evaluating the problems, the answer to a specific problem in a rural clinic may not be ChatGPT. It may be one of these smaller models that Jaya referred to that we can actually run on a laptop or even a mobile phone in order to provide a solution to the problem. So I think we'll keep evaluating, keep chipping away at it, but I think compute in general and internet access is becoming more ubiquitous as we move along, and that's helping to reach areas that previously wasn't possible at all.
And John, if I could add to Juan's point. So there is also this concept called distributed models using a primary secondary architecture, where you may have a primary model that is all-knowing and is sitting on the cloud. And what happens is this primary model will distribute these secondary or child models down to, like Rowan had stated, into devices such as tablets, phones. These models are highly diminutive, meaning much smaller, and customized for the specific geography where the model needs to run and function. And those models have the capability of functioning in a offline manner, allowing the healthcare workers to perform the task they need to perform effectively, helping healthcare workers make the right decisions. But at the same time, the models are smart enough that as soon as it detects it is back online, it's able to communicate back with its primary model, sending information back, getting further instructions. So those are some new distributed architectures that is currently being toyed with in organizations such as Google, because it's a well-known fact that in order for for generative AI to be effective, not just at the enterprise level, but at the consumer level, it needs to be able to function in a distributed and offline manner.
Great, thank you. We got a lot of questions flowing in. Here's one for you, Vedanta. This is a really interesting question. what are some of the barriers to the GAI outputs, such as trust? Is it blind trust, or is it a transformation of thinking?
Thanks, John. That's a very interesting one. It is, for me, a transformation of thinking. It is learning a new skill. So if you look at it, if you're teaching at university level and you ask your students to write an essay on a specific topic, they now have this tool, ChatGPT, that can write the essay for them.
Yep.
But if you asked this class to, knowing that they were going to use ChatGPT, to generate a response from ChatGPT and then critically evaluate that output. So what you've taught your class is how to think critically and assess information critically, assessing sources of information, going deeper than what these responses can generate. So in the same way, you can I look at trust in these systems as a mechanism of evolving how we think, of how we see words on a screen. For many, many years, we saw words on a screen and we assumed that they have to be right. A computer did this, it has to be right. So it is definitely a transformation, not only of thinking, but the transformation of what it means to be a human and to be a critical evaluator, a critical thinker in the fourth industrial revolution.
Great answer. I actually think I should suggest that exercise to my daughter's high school teacher. Good. Another actually really good question. And this is actually to the whole group. So what new roles do you see emerging as a result of generative AI in healthcare? We know there will be emerging roles in technology like prompt engineers, but any thoughts on the healthcare side? So that's open to anyone on the panel.
I guess I'll go first, John. So from my perspective, I see generative AI creating a scenario where we will be able to develop something I've coined as PLM, or private language models. Private language models trained in specific types of conditions. Let's use HIV. So we could potentially see clinics, hospital networks developing these private language models that are uniquely trained and understand a specific condition, with having been absorbed and fed with all possible available information on that condition. What happens is that these PLMs, or private language models, now becomes the de facto subject matter expert, the all-knowing, if I may use that term, oracle around that subject. And so then what happens then is this allows the human healthcare providers a subject matter expert that they can reach out to at any different point in time to validate their thought process, validate their thinking, help give feedback regarding decision making, treatment protocols, treatment plans. So this is, from my point of view, one of the many roles that I see that will potentially likely come out of generative AI.
Interesting.
I think an important one, and I'll
go for it,
add, John, maybe one. We spoke earlier about the need for these systems to be accurate and not provide false information. Now, historically, the way we develop systems is that someone wrote up a set of rules that was handed to the technology team, who then programmed that, and there was a quality assurance team that essentially checked the written rules. Is that what we coded? And we could easily validate that a system was functioning. With these generative models, that role of quality assurance has to shift all the way to the subject matter expert, which is not a technologist. That is the nurse or the doctor or the radiologist. Those will be the people that will need to ensure that there's quality built into the systems, and that we don't get false information or hallucination. So that's certainly a role that I can see emerging from what's currently a clinical role to be one a lot more technical, to validate what these systems are producing.
Good. And I'm just looking at the time, and we've got a lot more questions that we won't have time to answer, but let's try to squeeze in 2 more questions very quickly, and then we'll go to closing. So Ruan, if you can just continue on. The question is, to talk about the use of generative AI in HIV and TB programs. So this is actually a popular question. It came in a couple times. So maybe if you can give a couple, you started to in your introduction, but a couple pragmatic examples, and then we'll jump to our last question before closing.
Yeah, I think that there are two main buckets there. The one would be some kind of generic model or knowledge, like Jaya said. I think you coined it PLM, Jaya. So I think that's an interesting concept to unpack further. The other is to, in line with my thoughts on finding the problem, is to look at what are the specific issues in a disease area that are causing issues. And one example that I can give that we've been working on for a number of years is the problem of loss to follow-up, where we work so hard to get patients on treatment in the case of HIV, and then we lose them along the way. And being reactive and trying to find patients that have become lost in the system is very cost effective, and it's also very dangerous for their health. They become resistant to the drugs and so forth. So one of the things we've been doing is to say, can we proactively find the patients that are likely to default and engage with them before that happens. So that's a practical example of where we would be able to do that in the case of HIV. And again, this is work that's already been ongoing. What I'm excited about is that we can now use these generative technologies to make that message that goes out to the patient a lot more personal, a lot more engaging, so that the chance of them responding positively to the proactive outreach is much higher than it is today.
Thanks. And let's squeeze in one last question. This is a really good question. I think, Vedanta, you might be the best position to answer this. So there's a high rate of litigation emanating from treatment outcomes. So how can we overcome the challenge that can be posed by generative AI as patients may have many unique characteristics? I think this is basically looking at sort of bad outcomes when we rely on generative AI models, or any AI models for that matter.
Well, so if the question is, how do we overcome it? The answer would be, you don't rely on these systems alone for those purposes, and to understand very carefully what these systems can do, but more importantly, what they cannot do. They cannot discern, they cannot provide you with a suggestion over and above what a healthcare worker could. These are augmented tools. And one way in which we can limit the litigation and the potential catastrophes that happen is through informing the public with these limitations, about these limitations. And I guess I see it as an ethical issue. Then hopefully one day it might be seen as a legal issue when we are discussing these technologies in the media, or when we are advertising these technologies, that we do so in an accurate, clear manner. Not many people read terms and conditions before they click accept. That's another issue, which I think will become ethical and legislative in future, to ensure that users know what they are talking about. And it goes back to the question of informed consent. And now we look at it as informed terms and conditions. And I think these two things about how we have a responsibility as developers, as companies developing the software, as people developing policies around it, as healthcare workers, to inform the public of these limitations beforehand. Yeah.
Thank you. So I think in just the last few minutes, if we could do a rapid fire, and if each person, starting with Jaya, then Ruan, then Vedanta, if you could each give a parting thought, a minute on your thoughts that you want to leave with the audience, and then we'll wrap up.
Good. I'll go first. Thank you, John. So in conclusion, the future of healthcare holds immense promise with the integration and arrival of generative AI. This transformative technology has demonstrated its potential in personalized treatment plans, drug discovery, disease diagnosis, clinical trial recruitment, patient engagement, and more. It offers the possibility of improving patient care, reducing costs, and increasing accessibility to healthcare services. However, it's crucial to proceed with caution and address certain challenges, as we discussed. Data bias, data privacy, data security are some of the areas that demands attention. we must ensure that the data that is used to train generative AI models are diverse, representative, and free of bias to prevent discrimination and promote fairness. Additionally, protecting patient privacy and securing generative AI models from unauthorized access is also essential in maintaining trust and preventing misuse. Further, the explainability of generative AI models is essential in healthcare. Transparent and explainable models can install confidence in healthcare professionals and patients alike, enabling informed decision-making and fostering trust. So for healthcare workers, the integration of generative AI into existing platforms holds the promise of efficient workflows, improved decision-making, personalized care. By automating routine tasks, healthcare professionals can focus more on delivering quality patient care and leveraging the insights provided by generative AI for better treatment and outcomes. So in summary, while generative AI has the potential to revolutionize healthcare, it is crucial to approach its implementation responsibly by addressing the challenges of bias, privacy, security, and explainability. We can harness the power of generative AI to enhance healthcare delivery, advance medical research, and ultimately improve the well-being of individuals and communities. Through collaborative efforts between researchers, healthcare providers, policymakers, and society as a whole, we can shape a future where generative AI plays a key role in contributing to a healthier and more equitable world. Thank you, John.
Thank you.
And team for this.
Ron, parting shots?
Yeah, what an exciting time to be working in this field, and with all the potential that we have and the upside of technologies like generative AI. I think I've said it probably 3 or 4 times today, but I want to say it again: fall in love with the problem, not the solution. Wherever you work, go and find that problem that needs solving, and then let's work back from that into the technology. And when it comes to generative AI specifically, I think we should all be experimenting rapidly to better understand the technology, understand the strengths and the weaknesses, but let's deploy cautiously to ensure that we do so responsibly without causing any harm. Thanks, John.
Thank you. Vedanta?
In parting, I will say guardrails by design, not and by default. So make sure that policy and ethics become the cornerstone of how we take this technology forward. And I'd also want to echo what my fellow panelists have said. We live in an amazing time. We're living in the moment where we have the opportunity as South African healthcare professionals and experts to leapfrog and use this as an opportunity to catch up, sort of narrow the digital divide, use this as an opportunity to drive policy forward, not just for healthcare, but also to improve infrastructure, improve access to technology. And I would like to implore everyone to think about ways in which they can push this policy forward. Thank you.
Thank you. And my last parting thought is partnership and collaboration. So we're in this unique opportunity. It will take all of us, policymakers, private sector, financiers, donors, everyone, to work together collaboratively. The good news is this is not the first technology the world's ever seen. Fire was probably the first technology, and then the wheel after that. So we as a human race have had the ability to think about technology and how that's transformed our lives. So we have a really unique opportunity. If you do it in the right way, we can actually create a better world where better healthcare exists. So having said that, we're out of time. There's a ton of other questions, but I think clearly we need another webinar to address the rest of the questions. I'll hand it over to Joni to wrap things up with housekeeping.
Well, yes, thank you so much to our whole panel. It was fascinating discussion and a really lively set of questions. So to everyone that we didn't get to answer your questions, 1,000 apologies, but also 1,000 thank yous for coming on. We will be posting this webinar on our LinkedIn. It also will be on our YouTube channel. If you have other colleagues that you think might want to see it. And we look forward to more discussion and more debate with all of you. So thank you so much and have a wonderful rest of your day. Bye all.